Hello, my name is Cecilia Ortega. I'm a senior BSN nursing student at Pacific Lutheran University, and I did my preceptorship at Auburn Medical Center's emergency department.
Hello, my name is Silafau, and I am also a senior BSN nursing student at Pacific Lutheran University, and I did my preceptorship at Auburn Medical Center Progressive Care Unit. Our topic is transition of care from the emergency department to progressive care, pulmonary congestion in adults with acute decompensated heart failure. Heart failure occurs when the heart is unable to contract or relax, or a combination of the two. It can often be classified as left-sided or right-sided heart failure. Right-sided heart failure typically presents with systemic symptoms such as peripheral edema, while left-sided heart failure typically presents with respiratory symptoms such as pulmonary congestion. Acute decompensated heart failure is a term used to describe progressively worsening left-sided heart failure. When patients who have decompensated heart failure continue to decline rapidly, it is sometimes termed as flash pulmonary edema, which is a life-threatening condition. It is extremely preventable with early detection and treatment of acute decompensated heart failure. According to the American Heart Association, between 2013 and 2016, 121.5 million Americans had some form of cardiovascular disease.
We decided to pursue this topic because while at Auburn Medical Center, we noticed an influx of patients presenting to the emergency department with acute decompensated heart failure. These patients transitioned through the hospital from the emergency department to the intensive care unit and to the progressive care unit prior to discharge. One thing that surprised us was how much acute decompensated heart failure resembles other diagnoses and how early detection can slow down the progression of symptoms. Key diagnostic measures are chest x-rays and a confirmatory BNP lab test, which is the cardinal serum diagnostic test for heart failure. According to an article by Dr. Jason N. Katz, an advanced heart failure specialist, cardiologist, and critical care specialist at Duke Hospital, in-hospital mortalities for a patient with acute decompensated heart failure ranges from 3 to 4%, increasing to 10% at 90 days.
One thing we saw throughout our research was the importance of patient education of disease management. Most patients don't typically stay in the hospital for long periods of time. Therefore, it is important to use every opportunity to teach them how to prevent readmission.
While in the emergency department, most patients with acute decompensated heart failure typically present with reports of worsening dyspnea, which is shortness of breath due to pulmonary congestion, severe hypertension and tachycardia, which mean elevated blood pressure and heart rate. A priority while the patient is in the ED is to maintain adequate ventilation with the use of steroids and bronchodilators, which are medications that help decrease the inflammation and help open the bronchioles or the tubes leading into the lungs. A second major priority was the control of blood pressure to maintain a mean arterial pressure, or MAP, between 60 to 70 millimeters of mercury before being transferred to the intensive care unit. This was typically achieved with the nitro-titrating drip, a medication that helps open blood vessels and subsequently lowers blood pressure and heart rate.
In the PCU, we focused thoroughly on discharge planning to include patient education, as well as the importance of fluid restriction and weight monitoring, as well as vital sign and EKG monitoring.
Three things that we hope that people take from our project are: 1, early identification of symptoms, including those that are subjective to the patient, such as dyspnea or worsening shortness of breath. 2, the quick diagnosis and recognition in the emergency department, which can be achieved with diagnostic tests such as chest x-rays and serum BNP levels. And 3, the importance of patient education throughout the hospital admission, This will help prevent readmission and help the patient progress and better understand the disease management.
We hope that with this information, it'll be helpful in the teachings for preventions of readmissions for patients with acute decompensated heart failure.
Finally, we would like to take the time to acknowledge and thank our preceptors, Eric Krolik and Leica Dumag, along with all the staff at Auburn Medical Center and the POU nursing faculty, all of whom helped prepare us for this project and for our nursing careers. We are thankful for your patience and guidance through our long and stressful but well worth journey. Thank you.
Thank you.